rapidly enlarging neck mass. So I want you guys to recognize that I'm using a 10 megahertz linear transducer. Normally we're running at like 12 or 15 megahertz for the neck. We're at 5 centimeter depth. So this is the trachea.
I had a very similar case recently, and it turned out to be anaplastic thyroid cancer.
It's a good thought. But this is the thickness of the isthmus, 2.3 centimeters. So here's the right lobe. So no, we didn't find anything to measure, no defined nodule, but hugely enlarged. Again, here's the trachea.
We have 2 guesses for lymphoma.
Yes.
And prior Hashimoto's.
Exactly. So this patient had a history of Hashimoto's, and one of our fantastic surgeons called me up directly and said, I need you, during this COVID crisis, I need you to do a core biopsy on this thyroid, because I'm worried about thyroid lymphoma, because she's amazing. And that was the PET. And sure enough, we did a core biopsy, and it was B-cell lymphoma. So keep in mind that I rarely, if ever, do core biopsies of the thyroid because our pathologists don't know what to do with the information. We do all Bethesda criteria, which is based off of FNA only. So I've only really done core biopsies in cases of suspected lymphoma, metastasis, or anaplastic, which again are like less than 1% of what we see in the thyroid. So thyroid, it's about 1% of thyroid malignancies is thyroid lymphoma, and about 1 to 2% of all lymphomas are primary to the thyroid. So rare, but not, so rare that we won't see them once or twice a year. So just keep that in mind. Rapidly enlarging thyroid in someone with Hashimoto's. So there you go. I'll show you my other 2 cases next week.
I'm surprised you didn't give bubbles, and I'm surprised Ganai didn't biopsy it through the internal jugular vein.